Hi, Liz. Thank you for joining me. Okay. Okay, we're getting a quorum right away. All righty. Hi, Christine. Thank you for joining me. So this is going to be a very quick live. Quick, meaning that it'll be 30 minutes because I have another appointment. I have 2 appointments after this, starting at 8 my time. So I just wanted to come on because I did not have a episode filmed for today. I was supposed to film as soon as I got home, but I got home later than I thought that I would. So I said, you know what? A nice little surprise for everybody. I can come in, say hello, answer some questions, you know. Hi, Natalie. She says, hi, I need help. Tips for getting hired. I got my CPC in July. Ooh, got it a while ago, huh? Hi, Tasha. Hi, Tracy. Hi, Bethany. Hi, Sonia. Thank you all for joining me. Hi, Joanne. Okay, great. Okay. So I guess I'll go ahead and answer your question, Miss Natalie, because I have a couple of other questions that I want to address, but I'll go ahead and answer yours. Hi, S. Okay, so Natalie's question is, I need tips on getting hired. I got my CPC in July. If you, the first thing I'm going to say, your resume needs to be on point, meaning that it needs to be one page, preferably one page. It can be up to 2 pages, but really, for new medical coders, you should have one page. Honestly, if I'm being honest with you, I have done 2 page resumes. They've done well. It's not a big deal if you have 2 pages. Do not do more than 2 pages. But if you are a new coder, you should only have one page. And it should not go back more than 15 years of your work history, okay? If you say, well, you know, I haven't had any work history, you need to think of all the volunteer work that you've done. If you've been a parent, if you've been raising kids, that's actually a job. That's not for free because you're paying with your time. So that's something that you need to make sure that it's on there. But you need to make sure that you have your core skills on there. Even though you have no experience, you want to make sure that you have your core skills, which is that you know all the things that you were taught in the school, ICD 10 CM, CPT, Hicks PICS. I say those three because you have the CPC. And also that you know medical terminology, anatomy, pathophysiology. Those are the things that you see in the job listings. And you do not have to say excellent medical terminology when you're listing them on your skills. You just need to list your skills and list it right away. Do not put on there organized, team player, smiling face on your skills list. If you do that, if I'm the hiring manager, your resume goes right into the trash. Because why? You're not telling me your skills. I need somebody that's going to get right to the point. Nobody likes to have the person that's, you know, oh, Millie Mallying, because no one has the time, guys. No one has the time. So you want to get right to the point. You need to have an objective statement. People will argue with me about this. I am a professional resume writer. I know what I'm talking about. Every single one of us that does professional resumes, we all have our own style. I will say for me and my style is if I'm writing a resume, I'm going to write this resume so that the person that's looking at it instantly knows what this person is after because no one has time to waste. So you need to have an objective statement on there. And that objective statement needs to be clear about what you want and what you're bringing to the table. Not a big old long paragraph, just something that has the job title name that you want to apply for in it. And yes, this will mean that you will have to update your resume every single time. And no, no one wants to hear anybody complain about that because it's what we have to do. It's what I had to do. Okay. Also, applying at the temp agencies for medical professionals. If you Google temporary agencies for medical professionals in your area, you will see a whole list of all the temporary agencies. Now, these are not the staffing agencies that you see on LinkedIn. Those yahoos are looking for people who have experience, okay? Those are headhunters, okay? You don't want the headhunters. Nobody that does headhunting, you don't want those people. You want going to a temp agency because those people are committed to helping you find a job and helping you be able to get your foot in the door somewhere. Now, sometimes you may not be able to start off as a coder. You're still going to apply anyway. We're not going to put that on the back burner. We're still going to apply anyway. The thing that you need to know when you are out there applying is they will ask for experience. Everybody wants experience. Everybody wants a full-fledged CPC, or they want a CCS or CCSP or CCA. They want what they want and when they want it. It doesn't mean that you can't apply. I tell people this all the time. Applying for a job is free. You do not have to pay to apply for a job. And if happy coders are in your area and they have experience, they're going to stay where they're at. So that employer is going to be, hard luck, because if everybody that has experience is already working, they're going to have to take whoever applies. So you have to show yourself in the best possible light of, okay, here's all my training. This is where I went to school. These are all the jobs I've had in the last 15 years. Okay. And these were the transferable skills I did there. If you did the same type of job, do not write the same examples for each. If you worked at Dollar General and you counted the drawers, okay, so you have money handling. This means you know how to do math, so you could apply for a biller position, okay? That's one of your alternative positions. If you were a volunteer at a church and you took in the donations and you kept that information confidential on who donated what, again, that's a key word right there for you, right? Confidential, that you were able to maintain confidentiality. If you were a school teacher, now naturally, you're going to have to protect those kids. So what did you do that can be translatable to medical coding? That you protected sensitive information because of these students. And that's what you can put onto your resume as well. So you want to keep these bullets that are on your resume very to the point. And don't say responsible for. You need to give your words action, okay? What did you do? What did you do at that facility? What did you do at that organization? What did you do here? What did you do there, okay? If you have, here's another thing too, you guys got to know. If you have a bunch of jobs, and let's just say you kind of went from job to job, and you may have worked maybe a month or so, 2 months, I wouldn't put that on your resume. Why? Because it's going to look like you're a job hopper. And what are you doing hopping from job to job? You need to put things on there that are relevant to your search. Remember, the resume is just a glimpse of who you are. This is just the data. This is just, this is who I am. This is where I've worked. These are the skills I've built. And these are the skills that I do have. That's what that is. The cover letter, and you do have to write a cover letter. And I don't want to hear any complaints about the cover letter because I write one for all of my clients. And they do quite well with it because that's the human draw. That's where you can say you're organized, you're a team player. You're all these words that everybody is when they're looking for a job, right? So that's what you want to put on your cover letter. Your cover letter needs to be 3, no more than 4 paragraphs. Just something quick about who you are, what you can bring to their organization, how excited you are, and how your experience is relevant to what you want to do for their organization. And you apply. You apply even though they're asking for experience, even though they're saying, oh, 3 to 4 or 5 years is required, 10 years is required. If it's a coder, come on, man. You can have 3 to 4 or 5 years, 10 years, and still be a terrible coder if you're not studying. I'm just saying. People who are brand new bring that energy of, okay, this is something that's brand new. And maybe you didn't get the best teaching. And if you have that problem, if you didn't get the best teaching, that's when you could take the bull by the horns, folks. Get your workbooks. And I've said this so many times, and I feel like people just do not hear me, or I'm not speaking English when I say, in the description box of all of my videos are all the titles of all the books and the workbooks that I recommend. I do recommend that y'all still work them out. Even though you got your credential months ago, still work through the workbooks. Why? Because here's the thing. I talked about this with my Patreon audience tonight. We had our once a month live study hall on Patreon. And one of the things that I talked about with them was that you have to build that self confidence as a medical coder. It doesn't matter if you're brand new, it does not matter if you're a veteran, it does not matter if you're new to this organization. You have to build your confidence in your skill set. Because if you are not building your confidence in your skill set, it's going to show. And these doctors, they can smell fear, they can smell insecurity. And so that's what you want to make sure that you level off, that you're coming off like, hey, I know what I'm doing and I'm here to help you. We're here to be teammates. I'm not here to chase you with a red pen. I'm not here to scold you and do all of these things. I'm here to help you. I'm your teammate. And so that's what you need to build. That's the kind of presence that you have to have, because once they know that you're scared, they will run right over you. Hey, I want this procedure code and I want this diagnosis code, and you're going to pick them up. Oh, yes, sir. Oh, no, heck no. No. Wait a second. Is this supporting the documentation? Is this all of this supported? No. This is actually what's supported. This procedure code, this E&M level, this diagnosis code, that's what's supported. Well, I don't want that. Well, guess what? If you didn't do it, it didn't happen. If you did it, you need to document. Well, I don't want to. Well, too bad. Too bad. Do you want to get paid or not? You know what I mean? Like, that's the choice that they have to have, But they cannot sense that you are afraid or that you are unsure. And even if you don't know something, here's another thing too. If you don't know something, then tell them, okay, let me do some research on this for you and I will get right back to you, and then get back to them. Do not say, oh, I don't know. Because if it's one thing I don't like, it's incompetence. And then not only that, when you're sitting there straight up admitting incompetence. No. We're in a team. It is my job to know about the coding. So I'm going to figure this out. I will get back with you. Let me do some research on this. I need to confirm my thought process on this. And they'll be like, okay. Because you know what that shows? That shows initiative, and like, okay, she's going to make sure that she knows what she's talking about before she comes and says anything to me. And it's not going to be one of those situations where you're just going to speak and say, oh yeah, whatever you want to say, and then it's wrong. And then you have to go back and tell them, oh, hey, it's wrong. You know how many people won't do that? How many people won't go back and say that they were wrong? I'm just saying. So, all right, what did I miss? Okay, so hopefully that helps you out there a little bit, Natalie. Hi, Crystal. Hi, Katoya again. Hi, Alexandria. Hi, JR. I haven't been called Bluesy in a while. Alexandria, listen to Blue. Her tips got me really good results on my last interview. Holla. Alexandra says, congratulations, Natalie. Blue has a ton of videos on her channel for resumes and tips. Jennifer says, I update it every time I apply for a new job. Yay. JR says, that's the way to do it. JR says, I'm awesome, hire me. Marie says, I recently got my CRC certification, and since my place of employment needed a coder, they put me in that position. I need help. Exclamation point, exclamation point. I will need to get my CPC by the end of this year. We're in January. You have 11 months, 10 months once we get a little bit further on down the road. If you study, you'll get it. If you don't study and you still panic and you have all excuses not to study, then the result will be what it is. But if you study, you will pass. Hi, Jessica. Good evening, Blue. You are so inspiring and you have helped me tremendously. Oh, that's awesome. Thank you so much. JR, the CPC workbook is awesome. It is awesome. Marie says, what do I use to help me really understand coding, OBGYN surgeries, and general surgeries? The CPC study guide. Doesn't have to be the 2019 one, but I say this because it's literally in every last description box of all my videos, and I still get the question, what workbooks do you recommend? Even though I've done shows about workbooks. I don't know, guys. I don't know anymore. I really don't. Hi, Kai. Good evening, Blue. Jessica says, oh my God, they are like sharks. Once they smell fear and blood in the water, it's game over. True. Very true. Sonia says, can you restate the term with what we have to search for as a job with the CPCA certified in December? Thank you for your valuable suggestions. Can you give a link to those workbooks and resume rewrite? Doctors can diagnose fear. And that's true. Natalie says, thank you. You're welcome. Travis, let's talk about diabetes, hyperglycemia coding. What documentation is required? And then JR says, are there any topics that has never been asked? I don't know. I don't know, JR. I don't know. But like the 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 really the regular ones that I get, how do I get started? Uh, I'm confused about the study schedule. Although how you could be confused about the study schedule, I don't know. Because I literally lay it out. You have 2 months on this subject, 2 months on this subject, 4 months on this subject, and I break it down. And then I tell you all about like the hours in the week. I can't pinpoint times because everybody has a different schedule, but I at least tell you 30 minutes, 30 minutes, 30 minutes, 1 hour, 1 hour. That's 3.5 hours in one day. And then you do that for 5 days, that's 17.5 hours. And then you have 2.5 hours on the weekend. I don't know how much more exact I can be. You know what I'm saying? And so that when I get questions like that, it just it's so frustrating because like I just don't know. I don't know what else to say other than I've done the schedule. I've done the links where you can find the books. I've done which books to go for. I've done examples like where I show like the book and everything and all of these things and it's still just like I just don't know. I don't know, guys. I don't know. I don't know. So anyway, let's go ahead and talk about, hi, Miss Angie. Let's talk about the two questions that I got before my time is up. Because like I said, I got 2 appointments to go still after this. And they start at 8 o'clock my time. So in 13 minutes. So the first one says, has anyone gone straight for the CCS instead of the CCA? The program that I'm in prepares for the CCA, but I'm curious if it's possible to supplement to be prepared for the CCS instead. Is it worth it? If you're asking this question, is it worth it? Then I would seriously reconsider what are you trying to accomplish, okay? The difference between the CCA and the CCS. Both are well respected. It is the ignorant people out there that come up with some, oh, I know, nobody asked for a CCA. Really? I had it for 13 years. I ran circles around people who had degrees, who were nurses, and who had a plethora of other credentials, CPC, CPB, and all this other stuff. I ran circles around those people, and I made more than them. So when it comes, and I had the CCA at the time. So when it comes to, one is better than the other, there are people who are really talented who have the CCA. There are people who are really talented who have the CCS. There are people who don't know nothing about coding who have a CCA, also who have a CCS, also who have a CPC. So let's not point fingers about which one is better, okay? The CCA is a shorter exam. It's a 2-hour exam, but it does pack a punch, okay? So there's quite a bit of questions on this one. It covers inpatient and outpatient coding. So you can go anywhere. You can work at a hospital. You can work at a doctor's office. You can work anywhere, okay, with the CCA. CCS. This says that you have mastered inpatient and outpatient coding, whereas the CCA says that you're an entry level. This is a beginner thing for you. Are there people who are beginners who have taken the CCS and passed it successfully? Yes. But those people also struggle because their credential says that they've mastered inpatient and outpatient coding. So when they're out there applying, more is expected from them, like, okay, well, you have this advanced credential, so what are you going to do with it? So that's the thing that you need to know about those two. You can start off with the CCA if you wanted to and wait a year and see, hey, you know what, I need to study a little bit more so that I can get the CCS. Because once you get that CCS, that CCA gets dissolved. It gets what they call superseded because you cannot carry a CCA and a CCSP. You cannot carry a CCA and a CCS, because the CCA is again entry level. And I've talked to Ahima about this, but they said no, that's just the way they do things. Okay, fine. So, because the CCA is very difficult to get, guys, and you can look at the pass fail rates on the Ahima website to be able to see that. So that's something that you got to know there. The other question that I wanted to address, so you can go either way. Start with the CCA if you want to, study for a year, and then get your CCS if you want to do that. So that way you can be more confident. Or supplement your studies and take the CCS and then just see. Because either way, you could pass or fail that CCA, or either way, you could pass or fail that CCS. It's entirely up to you. If you're studying 20 hours per week, like I tell y'all to, if you are taking your breaks responsibly, like 30 minutes, after 30 minutes, or after 1 hour, then you're good to go. If you're reading the coding guidelines in their entirety once per week, and that's for any medical coding certification exam, if you are doing that, you're going to be even more prepared when you walk in that door to be more confident. Hey, I already know what I'm doing. So, just something for y'all to think about. This other comment comes in from LinkedIn. It says, and this is something that I want to talk to y'all about really quick too. Courtesy. Courtesy when you're asking questions, because you may not be sure. But do not send somebody who is a professional an email like this, where you start off like this. I'm going to say this, okay? They said, "Hi, Blue. I'm not sure if you can help, but I saw you on YouTube and I wanted to see if you had any advice to offer as I'm trying to decide which direction I want my career to go in." Well, guess what? What do you think I want to do with something like this? Hit the delete button. Why? Because you just said, "I'm not sure if you can help." So why are you all of a sudden doubting that I'm going to be able to help you or not? You see that I have a YouTube channel. You see that I have over 1,100 videos on it covering every single topic known to man. Everybody says how helpful I am. That's not just here. It's on LinkedIn. It's on Instagram. It's on all these places. And how I've impacted them and been able to help. And then you want to come on and say something like that to me? To me, that was insulting. So already I'm annoyed, because don't ever put that on somebody that's professional like that. "Oh, I don't know if you can help." Because that same kind of wording, they're probably going to put that in an email to a provider. "I don't know if this will help you or not." So just get right to the point, guys. That's all I'm asking, is just get right to the point. But they said, "I have my CPC, Certified Professional Coder, COC, Certified Outpatient Coder," which basically is the same thing. You're overlapping. "And CEMA, right? I'm looking at getting an Ahima certification and was thinking of getting the RHIA. Would this be the best direction to go into, considering my current certifications, or do you have another suggestion?" First of all, an RHIA requires you to have a bachelor's degree in health information management. But you would know that if you were doing your research. So this is why I'm saying, this is not an RHIA, RHIT. These are not anything to sneeze at. These are the degree designations. They require a degree to get them. You can't just say, "Well, I have a CPC, a COC, a CEMA, QRSTUV, and I want to get this RHIA." Really? No. You need a degree. But if you know what the credential is and you're running around asking about it, don't you think it's prudent to do your research and make sure that you know what is required and how you get it? Because it's not something that you can just sit for. I've had that question before where, "Oh, can I just sit for the RHIT? I have all this experience and all this." I don't care. And neither do they. You have to go through the programs that have been approved through CAHIM, so that way they know that you have been tested, tried and true on the particular subjects for those credentials. So that's why I say, the only thing I told this lady was she can go to the Ahima website. And it's true. Okay, so again, if you're going to ask a question to a professional, not just me, there's other professionals out there that are in health information. You make sure that I'm telling you this on behalf of all of us that are these creators. Get right to the point, because that will make your question more appealing to answer. I'm just saying. All right. So JR says, do you get concerned about the future of coders when quite a few people will not do the basic research and want their handheld? Yes, JR. Yes. I do get concerned. Uh, Katoya says, Sonia, check the description box below. Blue has the links there and the information for the resumes. Natalie says, how do I contact you for the professional resume and cover letter? In the description box below, honey. In the description box below. And thank you, Katoya, so much for your help on answering that one. You're welcome, Alexandria. All right, guys, I got 5 minutes. So, but yeah, that's just what I want to say about that. And guys, you got to do your research. You do, because no one is going to hold your hand in the real world. They won't. You may get some people, but it's going to be very few and far in between because medical coding is very competitive. The industry is very competitive. And you know what? I will say this before I wrap it up. The messages that I give on here, they literally do come from a place of love, whether you believe it or not. And whether or not my expression of that love lines up with yours, what I've been able to do since 2018 being on YouTube is help a lot of people. And I'm going to continue to help a lot of people. And I will never change. I will never change. I'm going to make that promise to y'all right now. I will never change who I am, the intensity of my message. I will never change that because I want a good future for people. And I want people to be prepared. There's a lot of people who just lack direction. They lack discipline. And when you hear something that I say, and a lot of people have told me time and time again, Blue, I heard your words while I was taking the test and I was about to give up. And I said to myself, no, because I can do this because Blue said I could. And they passed their test. So if I came on here making mouths and, oh, everything is lovely and everything is beautiful and wonderful, do you think my message would have the same impact? Probably not, because that would be being fake. And I am not a fake person. That is far from what I am. So take it or leave it. And if you don't like something that I say, it's perfectly fine. We are okay to have differing opinions. We don't always have to agree. But when you sit here and you think like you know better than I do, when I have all of these years of experience and all of these things that I've encountered in order to make me who I am today, don't. Just keep it to yourself, because trust me, you don't want to hear the response sometimes. I'm just saying. So with that said, yes, Miss Angie, tough love. Jessica says, you're in my head when I'm working through the workbooks. Yep. What would Blue do? All right, guys. So I'm going to go ahead and wrap this one up because, like I said, I got 2 appointments and I got to be on time. So I'm going to see y'all on the next episode. I will do an episode for tonight, for tomorrow. So y'all will get the regular pre-filmed episode tomorrow. So I will see y'all then. Have a great night, everybody. Bye.